Hello, welcome to Midlands Today. The headlines tonight. Transforms the lives of people with Parkinson's disease.
It improves your walking, and the fact that you can play golf again, which makes a huge difference to me, is amazing. Yeah.
Tony Howells from Herefordshire is the first in the world to have the device fitted. Good evening, and we start with news of a remarkable medical breakthrough. A builder from Ross-on-Wye in Herefordshire has become the first person to be fitted with the world's smallest deep brain stimulation device to control his Parkinson's disease. Tony Howells struggled to walk 200 yards before the surgery, but the procedure has significantly improved his quality of life. Our health correspondent, Michele Paduano, has been to meet him.
A club champion with a handicap of 3. It was while playing golf that Tony Howells noticed a hand tremor. That led to a diagnosis of Parkinson's disease. Eventually, he could no longer play the game he loved. But now, he's back on the fairway.
The fact that they can put deep brain stimulation into your brain, and it improves your walking, and the fact that you can play golf again, which makes a huge difference to me, is amazing. Yeah. I would recommend it.
When I look back at the videos they've taken, seeing how he was on a regular basis, you didn't realise how bad it was until you saw the good after the operation.
Before and after pictures are dramatic. The deep brain stimulation device encourages the production of the hormone dopamine. Since implantation, Tony's drug use has halved, and his coordination is unrecognisable, but the benefits are psychological as well as physical.
Some people we wouldn't say anything, but they obviously see you shaking and moving about, and it's what you think that they think about you is a problem. So you in the end you don't bother going out.
The implant was developed in Bristol and put in by surgeons there. It takes 3 hours, half the time of the traditional operation, and that's an advantage.
5% of people with Parkinson's have it at the moment, partly because of the types of surgery. It could broaden it out to about 10.
So Tony Howells is looking forward to life, and the horizon doesn't look anywhere near as bleak as it did. Michele Paduano, BBC Midlands Today in Ross-on-Wye.
Well, Professor David Dexter is Associate Research Director with the charity Parkinson's UK. He described to me just how important this development is.
This is an important medical breakthrough because it's a refinement of an existing technology. And as you say, Tony has been the first recipient of this new device. So this is a miniaturized version of the existing deep brain stimulators. And so this new miniaturized version can be fitted in one surgical go. So in about 3.5 hours, the patient is returning out of the surgical operating room. Whereas previously, with existing devices, you need a 2-stage operation, and obviously that has double the risk.
The trial, I think, is still ongoing, isn't it? But they're still looking for suitable patients. Is that right?
That's correct, yes. So generally they're looking for people, with more advanced Parkinson's who are not responding properly to the medications. So the medications aren't currently controlling their symptoms. So these people are really suitable for this type of procedure.
How soon do you think this type of procedure would become more standard practice?
So it's not going to be a quick journey to the clinic. So you need to do all the checks and balances, and the regulatory authorities need to be happy that this device is safe before we can start using it more generally. But it could change people's lives, because if you halve the surgery time, the surgeons can actually fit more of these deep brain stimulators and bring benefit to people with Parkinson's. We've got about 145,000 people with Parkinson's in the UK at the moment.
And there's no cure, of course, for Parkinson's. I mean, do you think enough research is done into Parkinson's disease?
Sometimes we're often seen as the poor relation of Alzheimer's and dementia, because there's lower incidence of Parkinson's. But we would still like to see more investment, because we do need drugs which will actually stop Parkinson's in its tracks. It's almost 60 years since the initial drugs that were developed to treat Parkinson's.
Well, that was Professor David Dexter from Parkinson's UK, and for more information on DBS, go to parkinsons.org.uk.